How to get rid of thrush. Thrush is a form of yeast infection caused by the Candida fungus. It often affects the mouth and causes white patches inside the mouth, on the gums and on the tongue. Painful lesions and open red sores can develop under these curd-like white patches. Thrush can occur on other areas of the body, as well, causing vaginal yeast infections in women and diaper rash in infants. Thrush can affect anyone, but it is more prevalent in infants, older adults and those with delicate or weak immune systems. Trying home remedies for oral thrush. Try oil pulling. Oil pulling rests on the yet untested theory that oils literally pulls toxins out of your system. 1. Although results haven't been conclusive, many people use oil pulling to fight the Candida fungus and to provide temporary relief. Here's how to do it. The process is quite simple. Brush your teeth beforehand. Oil pull on an empty stomach if at all possible. Take 1 tablespoon of oil and swirl it around in your mouth for 5 to 10 minutes. Make sure it coats every possible part of your mouth, under your tongue, in your gums, the roof of your mouth. After 5 to 10 minutes, spit the oil out and rinse with salt water. You can do this twice per day for 5 days. Try doing it once after you wake up in the morning and again before bed. Use coconut oil for best results, although olive oil works too. Coconut oil is rumored to be particularly effective in fighting fungi. Try taking thyme. The herb thyme is also supposed to be an effective aid in getting rid of oral thrush, although science has yet to substantiate it. 2. In Europe, thyme is used to treat upper respiratory conditions and thrush. Try sprinkling a moderate amount of thyme on any dish that will take it. You could even make a tincture out of it. Swish with apple cider vinegar. Take a little bit of apple cider vinegar, dilute it with about a half part of distilled water, and swish it in your mouth for several minutes. 3. Another option is to mix 1 tablespoon of apple cider vinegar in a full 8 ounces of water and drink before every meal. The vinegar is supposed to fight off intestinal yeast overgrowth that sometimes contributes to oral thrush. Some people find this method impossible because of the strong taste associated with the vinegar. You might also experience stomach gurgling when you start the treatment, so don't start this treatment right before a meeting or another situation where you may feel embarrassed. Try eating more garlic. Garlic, replete with several different sulfur-containing compounds such as allicin, allein, alliinase and S-L-cysteine, is reputed to help fight a broad range of fungi, including thrush. Fresh garlic works better than garlic pills, so try to find a way to get more of it into your diet. For best results, try taking 4 to 5 crushed cloves of garlic per day. If you're worried about chaotic garlic breath, try drinking 3 to 4 cups of garlic tea daily. Use a bit of tea tree oil. Tea tree oil is renowned for its antifungal and antibacterial properties. 4. It's a common home remedy for everything from acne to athlete's foot. But it's also used for thrush. Dilute 1 or 2 drops into a tablespoon of distilled water, insert Q-tip, and dab onto sores inside the mouth. 5. Rinse mouth afterwards with salt water. Preventing thrush. Take preventative measures to keep oral thrush from returning. After you get rid of thrush, it is important to do what you can to prevent it from coming back. This includes brushing your teeth 2 to 3 times a day. Replacing your toothbrush often, especially during a thrush outbreak. Being sure to floss your teeth once a day. Refrain from using mouthwash, breath sprays or breath mints. These products tend to upset the normal microorganism balance in your mouth. Remember that your body contains a host of good microorganisms that effectively serve to fight bad ones. Harming these may pave the way for the bad ones to take over. Instead, you can use a saline solution to rinse your mouth. You can create a saline solution by stirring half a spoon of salt into a glass of warm water. Visit your dentist at least twice a year. It is important to see your dentist at least twice per year, and more often if you wear dentures or have diabetes or a weak immune system. A dentist may be able to spot a thrush outbreak, or possible outbreak, sooner than you will, leading to quicker treatment. Cut down on your sugar and starch intake. Candida fungus thrives on sugar. To stop it from thriving, you should cut down on the amount of starches you eat. This includes beer, bread, soda, alcohol, most cereals and wine. These foods feed the fungus and can prolong the Candida infection. Quit smoking. Smokers are more likely to develop oral thrush than non-smokers. If you smoke, then do what you can to quit. Talk to why using medically verified treatments for oral thrush or doctor for information about medications and other options to help you quit smoking. Use amphotericin B when other medicaments for oral thrush. Visit your dentist or your family doctor. If you think you have thrush, then it is important to see your dentist or family doctor for an evaluation and diagnosis. If a medical professional determines that you have oral thrush, he will start your treatment immediately. Healthy adults and children can get rid of thrush more easily than others. Begin treatment as soon as possible. Treatment for thrush in healthy patients generally starts with acidophilus tablets. 6. A medical professional may also suggest eating plain unsweetened yogurt. Acidophilus and plain yogurt will not destroy fungus, but they will reduce the infection and help restore a normal balance of bacterial flora in your body. Acidophilus and yogurts are both probiotics. Rinse your mouth with a warm saltwater solution. Saltwater temporarily creates an inhospitable environment for the thrush fungus to live in. Add half teaspoon, 2.5 milliliters, of table salt to 1 cup, 237 milliliters, warm water. Stir well before rinsing. Take an antifungal medication. Your doctor can prescribe an antifungal medication if symptoms persist or if you have a weak immune system. You will generally take an antifungal medication for a period of 10 to 14 days. This medication is available in tablets, lozenges and liquid forms. Make certain you take this medication as directed and in its entirety. Antibiotics may also produce thrush, especially in women or in patients who have experienced thrush in the past. In this case, your doctor may ask you to take an antifungal medication along with antibiotics. Getting rid of vaginal thrush. Wait for your period. Vaginal thrush is actually just a yeast infection. While you can't dictate when you go on your period, menstruation will change the pH of the vagina, rendering it less hospitable for the Candida fungus. Use the laced tampon strategy. Lace your tampon with a little something, although probably not during your period. Here are some suggestions for what to lace your tampon with in order to combat vaginal thrush. Dip it in unsweetened yogurt. Apply the tampon immediately, before it expands. Guard especially against leakage. Dip it in diluted tea tree oil. Apply the tampon immediately, before it expands. Guard especially against leakage. Try to avoid using latex condoms, spermicidal creams, and lubricants. In fact, in addition to avoiding these, try to avoid sex during a yeast infection. Yeast infections can be transmitted back and forth during sex, creating a vicious cycle and prolonging the